Hello, it's me, Dr. Butler. So last week I mentioned that today's video I will cover supplements and diet. Well, quick change. As I started writing and research, I realized this video will probably be about an hour. I try to keep the videos around 10 minutes or so. So what I'm going to do is I'm going to take that supplements and diet video and just make a small series with this. So small videos each week. So today, I am excited to dive into the world of supplements that helps alleviate some joint pain and hot flashes. Let's explore ways to lighten some of the symptoms and improve our well-being during this transition. Now, as I get into the world of supplements, please, before anything else, please, talk to your healthcare provider. Making wise choices for your health always starts with good guidance. Now, a few weeks ago, I mentioned taking vitamin D and calcium supplements for joint pain. Let's get into why. As our estrogen levels decline, it accelerates bone loss, which means our body is less efficient at absorbing calcium and maintaining strong bones. Calcium is the primary building block of bone tissue. Adequate intake is essential to slow down the rate of bone mineral density loss and reduce the risk of developing osteoporosis, a condition that makes bones brittle and prone to fractures. The recommended daily intake of calcium increases during postmenopause. Most healthcare organizations recommend that women ages 51 and older aim for 1,200 milligrams of calcium daily from diet and supplements combined. Vitamin D is essential for our overall health and well-being. It's produced by our liver and our kidneys when our skin is exposed to sunlight. Vitamin D is not naturally found in foods, although we can find it in foods like salmon and mushrooms. Now, our estrogen level decreases, our skin and our kidney no longer produces vitamin D efficiently, and our gut doesn't absorb it as well either. This can lead to osteoporosis, vaginal health issues, and low mood. With osteoporosis, we need to focus on our bone health, with slowing down the breakdown process of bones and speeding up the rebuilding process of bones. During the menopausal stages, estrogen levels drop sharply, disrupting the neurotransmitters like serotonin and dopamine, which regulates the mood. Vitamin D plays a crucial role in this process by helping to respond to stress and regulate mood. So what are some other supplements we can take? I'm so glad you asked, friend. Let's get into these symptoms about these hot flashes. Let's get into that, them hot flashes. So hot flashes are triggered by a combination of hormonal changes, especially declining estrogen, and there are external factors that disrupts our body's temperature regulation. Common triggers include heat, stress, spicy food, alcohol, and caffeine. Although there are some lifestyle changes we can do to eliminate the symptoms, such as limiting spicy foods, limiting alcohol, especially red wine, because it contains histamines and sulfites, caffeine, and we need to reduce large or sugary meals. We also need to reduce smoking, wearing tight clothing, or wearing heavy layers. Limit being in a hot environment. I live in San Antonio. We need to limit being in a hot environment. We need to reduce stress and anxiety triggers. Don't overexert yourself. Now, what are the over-the-counter medications we can take? We can take Black Cohosh, red clover, Chasteberry, Dong Quai, and evening primrose. These are popular supplements. Black Cohosh comes from the popular herb buttercup family and has been recommended by several doctors. It can be purchased online or in stores at places such as Target, Walmart, pharmacy, and nutrition stores. However, there are several side effects reported such as liver damage, upset stomach, headache, low blood pressure, and even a rash. And it's only recommended for a short time use, like typically up to 6 months. Please note that Black Cohosh should be avoided by women who have experienced breast cancer due to its potential estrogen-like effects. Another highly recommended supplement is red clover. However, use with caution if you have a soy intolerance because it contains isoflavones. Red clover is a wild flowering plant that belongs to the leguminum family, which includes beans and peas. In addition, with helping with hot flashes, red clover is also used to help with bone loss and high cholesterol. So now studies show no side effects when it's used for hot flashes alone. However, there have been side effects reported when it's being used for high cholesterol, such as back pain, bloating, and stomach pain. Red clover is not recommended for women who have experienced breast cancer or women who are over the age of 65. It can be purchased online and in stores at places such as Target, Walmart, pharmacies, and nutrition stores. So now I just mentioned about the isoflavones. What's that? What's the isoflavone? Isoflavones are plant-based compounds primarily found in soybeans, and it mimics the action of estrogen because it has a similar structure. It has been used for hot flashes and night sweats. It's used to support bone and cardiovascular health. It is used to reduce certain types of cancer, and it improves metabolic health. But depending on your body's existing hormone levels, isoflavones may produce an estrogenic or an anti-estrogenic effect. The estrogenic effect occurs when the natural estrogen levels are low, and isoflavones acts as estrogen-like responses. Now, the anti-estrogenic effect occurs when the estrogen levels are high, typically during the pre-menopause stages. So now let's remember, the pre-menopause stage occurs when a young lady has her first menstrual cycle and she is now in her reproductive years. This is when you already have estrogen, so your estrogen level is pretty high. So when you take isoflavone, it's going to give you more estrogen. So now you're going to have too much estrogen. And when you have too much estrogen, it's the natural estrogen is going to compete to bind with the receptors. And this is going to lead to the development of menopausal symptoms. So what I'm saying is, if you take the isoflavones during the premenopause stage, you're going to have too much estrogen. If you have too much estrogen, you're going to start having menopausal symptoms. So now the isoflavones are found in several plants such as soybeans and edamame, tofu, miso, which is a paste that comes from soybean, and tempeh, which is a soybean-based meat alternative. Then it's in chickpeas and peanuts. It can be purchased online or in stores at Target, Walmart, pharmacy, and nutrition stores. Next, we have the chasteberry, which is known as the Vitex. And it comes from a fruit of the chastise tree. It's a shrub of the Mediterranean region, and it has been used as a natural remedy for women's health for over 2,500 years. In the 1970s, Vitex became popular for helping with various issues related to the female reproductive system. It helps with PMS, infertility, breast tenderness, better lactation, and menopausal symptoms such as hot flashes, vaginal dryness, night sweats, lack of libido, mood swings, and interrupted sleep or insomnia. Vitex helps with the pituitary gland to rebalance hormones during the menopausal stages. By helping to slow excessive hormone secretion and boosting the production of insufficient hormones, Vitex is known to significantly help maintain healthy hormones. But there have been some mild side effects such as diarrhea, nausea, stomach discomfort, and a rash. There's also reports of interaction to drugs such as birth control, hormone replacement therapy, and dopamine related medications for Parkinson's disease and certain psychiatric conditions. Another supplement used for hot flashes is Dong Quai, which is known as the female ginseng. This is used for PMS symptoms such as breast swelling, mood swings, headaches, and it can be used for hot flashes. Dong Quai is a Chinese herb that comes in the form of a pill, a capsule, liquid, or a powder. Now, there are mixed scientific evidence regarding this supplement. It is believed that the Dong Quai binds with the estrogen receptors to strengthen bones by increasing bone cell formation, reduces blood sugar by reversing insulin resistance, it promotes heart health by decreasing cholesterol levels, it provides an antioxidant and an anti-inflammatory support by decreasing levels of several different inflammatory markers. And lastly, it balances estrogen activities to relieve hot flashes when used with German chamomile to help increase serotonin receptors. So, what is German chamomile? It's a small daisy-like flower with white petals and a yellow center. It's available in tea bags, dried flowers, capsules, or oil form. And it helps with mild anxiety, sleep problem, and digestive discomfort, and topical irritation. The last supplement I'm going to discuss to relieve hot flashes is evening primrose. Evening primrose is a North American fragmented lemon-scented yellow flower that opens up in the evening and it closes in the day. Hence the name evening primrose. Now, seeds are extracted from this flower to make an oil that is available in capsule or liquid. Evening primrose has been used in alternative medicine as possibly effective aid in treating nerve damage caused by diabetes and osteoporosis. It has also been used for asthma, eczema, attention deficit hyperactivity disorder, ADHD, hepatitis B, high cholesterol, liver cancer, breast pain, obesity, and night flashes and night sweats. It's also used for PMS, and it can be used for skin or joint pain symptoms of psoriasis. Whew, that's a lot. But now that I have discussed some supplements for joint pain and hot flashes, I hope you feel more empowered to deal with these symptoms. Real quick, before I get out of here, don't forget about my Black Friday specials, which is a 30-minute group session focusing on menopausal symptoms. And if you purchase any packages on Friday, you will receive a 25% discount. And I also have gift cards available to purchase for the same discount. On Saturday, which is Small Business Saturday, I will be having free assessments and workout when you purchase a session package. So the assessments are typically $25, which will be credited to any package that you purchase on Saturday, making the session free. Lastly, Monday, December 1st, which is Cyber Monday, all virtual sessions will be $10. Let's jump on those 2026 goals today. Also, Friday is the regular virtual session. I'm going to be doing my last stretch session for this year, and that will be at 9 o'clock Central Standard Time instead of 7 o'clock. So I will see you then. Talk to you next week. Bye-bye.